Aaron, thank you for organizing this panel. And Elliot, I'm no longer going to take out my hostility with the Humana pharmacy lady on the phone when I try and coordinate the medication renewal dates. Thank you for explaining that to me. Okay, I'm happy to introduce to you our afternoon keynote speaker, Dusty Majumdar. Dusty leads all aspects of marketing for IBM Watson Health and IBM Healthcare and Life Sciences as Vice President and Chief Marketing Officer. With over 20 years of marketing and leadership experience, he's focused on driving market excellence across the organization. He has deep domain experience and expertise in healthcare, ranging from strategic marketing to go-to-market execution in companies such as GE Healthcare and more recently a diagnostic startup, Exact Sciences. Dusty has over 25 patents in his name, and his work has appeared in over 30 peer-reviewed publications. Dusty, thank you for joining us. We look forward to your keynote presentation. Please replace me at the podium.
Thank you. So thanks for the very kind invitation and the introduction to this talk. IBM Watson Health is actually a startup, believe it or not, inside IBM. That's the way Janira Mehdi and the leadership team look at IBM Watson Health. I have been in IBM Watson Health roughly for around a year and a half now. Came from a startup. I was in GE Healthcare and GE for 20 years and then moved to a startup to detect cancer early in blood. Spent a couple of years there and then moved to IBM Watson Health. I'm located right here in Cambridge. We have a wonderful building for those of you who are in Boston or Cambridge. On Binney Street, IBM Watson Health has built a beautiful building that houses all the activities of IBM Watson Health. So it's a health-focused facility. Delighted to be here at MIT. I think the last time I was here was probably 35 years ago when my cousin was actually doing his PhD at the MIT Sloan Institute. Some of you might know his name, those of you who have been around long enough, and I'll talk to you at the reception about him. This talk really just gives you a small sliver of what we're doing at IBM Watson Health. I'm just going to focus on a couple of key areas. First of all, I think it's great that we are collaborating now with MIT. The official seal of MIT depicting the motto mens et manus, which is Latin for mind and hand. And that's kind of what we're trying to do here, putting our minds and hands together between IBM and MIT to take AI, deep learning, quantum computing to the next level. And I'll briefly touch on some of the things and what their implications really are to the world, really, because two of the great institutes coming together. But this is nothing new. We actually, in IBM, sponsored a conference back in 1981, held at the Endicott House, where Richard Feynman actually chaired this conference, and the focus was quantum computing. And Richard Feynman, at that point of time, talked about simulating physics with computers. What if we don't have to deal with 0 and 1? And maybe we have computers that actually deal with something in between, which is at the heart of quantum computing. That's Richard Feynman. Well, after the years, he won his Nobel Prize, I think, very famous by that time. I just came back. The reason I could not attend the dinner last night was I was at a conference called RSNA. Who knows what RSNA stands for? Quite a few people from the industry would know. The Radiological Society of North America. And I've been going to the Radiological Society of North America for 20 plus years. I've never seen anything like what I saw in a day and a half, where every single company is starting to talk about AI and deep learning and machine learning, a lot of buzzwords, big data. Big data is kind of gone now. It's all about deep learning. And so why are all these companies jumping into AI? And there's a hype, certain degree of hype that's been created around AI. look at some of the headlines there. A blowout year for AI in radiology. FDA is now getting into the business of actually giving clearance for certain types of systems that use AI. My old company, General Electric, just announced a collaboration with NVIDIA. We have a booth, actually even now, it's going on till tomorrow, at Watson Health, which has just been thronged by radiologists. So why are all these people interested in AI, and why is it such a big buzz at this point? I just saw a radiologist from UK talking about the challenges in radiology, and that's just one aspect of where AI is playing today in healthcare. 7 radiologists out of 100,000 people in the UK. So think about that. So what's happening here? Ultimately, patients are waiting for a month just for their imaging results. They can't get anything. They're waiting there for a month. They have a scan of their liver, and now they know there's something wrong, but they can't really see a scan of the lesions that might be in the liver. And radiology is just the start. I mean, that's the start of just kind of locating where the problem is. After that, you got to do a biopsy, you got to do repeat imaging, you got to do all kinds of stuff to figure out what's going on. And then surgery, or maybe chemotherapy, right? So this is a big issue right now around the world. The same radiologist from the UK showed us this chart where the dark green represents the waiting list and the light green represents the activity. So you can see the waiting lists are growing constantly. And why is this happening? So are the radiologists lazy? No. They're working hard. They're working harder than ever before. In fact, the latest statistics show that there's at least 2 hours of pajama time at the end of the day that the radiologists put in to input data into the EMR system, to go through different kinds of scans, and try to figure out how to write a report based on the fuzzy images they're seeing. And then, they are also very careful at this point with the litigious environment that is there in the world of healthcare, right? So we're also seeing this across the board, not just in imaging. In imaging, there are probably 100 companies. Somebody said 400,000 apps or something in the last year. There have been close to 250 new healthcare startups in the last 18 months. Over 100 of them are in imaging. A bunch of them in oncology, cancer, and genomics, and value-based care transition that we are seeing. And look at this. Look at the plethora of companies which are now getting into healthcare on nutrition and lifestyle management and mental health and virtual assistants and wearables, and a lot of them in Kendall Square. And a lot of them in the very early stages of technology. But there is a lot of money available, and there's a lot of companies jumping in the fray. So what are the different challenges we have today? Data is exploding. It's exploding every 73 days. 51% of physicians, I think the number is more like 80, but the research shows it's around 51% of physicians are showing experience of burnout, right? I mean, they are completely fatigued. The joy has been taken out from the medical profession in a lot of cases. A lot of waste. 2 billion people are going to be over the age of 60 by 2050. We're going to have more centurions than ever before in the next 10 years, actually, in the US. Already in Japan, there is over 1 million people, over 100 at this point living. So the challenges are enormous. $9,990 per year per person we are paying for healthcare. That roughly translates to $30 a day. It's kind of the same price as a parking spot in Kendall Square, right? A lot of shift going on, a lot of chaos and turmoil right in the system right now with, are we going to get rid of Obamacare? Are we going to keep parts of it? Are we going to, change it completely? Huge shortage of physicians, and that is probably going to get exacerbated if we stop physicians from other countries coming in and doing the good work that they're doing. And the data is, doubling every 73 days, and it's going to keep doubling and tripling after 2020 at this point. So I think most of you in this audience understand that what's going on here is completely untenable. No human being can keep track of the 250,000 clinical trials that are running, of the 7,000 publications, healthcare publications per day that are going out around the world. And not all of them are world class, so how do you sift through all of that? Clinical trials are having a tough time recruiting patients. 1 in 10 clinical trials are shut down for lack of participation, and less than 10% of the drugs in development are making it to the market. So a lot of waste in the system. In fact, it's mega waste in the system. 8 out of the 8 trillion spent globally in healthcare, there's 2 trillion waste. In the US, around 2.5 to 3 trillion are spent in healthcare. Out of that, 1 trillion is waste. So where is the waste, waste coming from? From a variety of sources. Imaging, the show that I just came back from, contributes to a lot of waste. False positives in imaging. Imaging has improved over the last 20 or 25 years that I've been involved very deeply in, but we see more and more. And the problem with seeing more is we don't know what to do with it. And there is a lot of interventions right now that happens for no reason at all. Oncology, cancer care, lots of variability in cancer care. The cancer care that you'd get here in Boston or Cambridge, very different from what you'd get in El Paso, Texas. And one of our goals in Watson Health, and one of our first goals, was to really look at how we reduce variability in terms of cancer care. We talked about the failed clinical trials in life sciences around the world, a lot of fraud, waste, and abuse in the area of with various governments. We're working with many state governments at this point to reduce the amount of waste, and the transition from fee-for-service to value-based care, managing populations with diabetes or high risk of lung cancer because they smoked a lot, is a huge challenge, both in the US and around the world. So that's what we are trying to do. We are trying to, and we're in very early stages, really, in a lot of these areas, trying to address the challenges that we have in healthcare, improve lives, and give hope by delivering innovation to address the world's most pressing health challenges through data and cognitive insights. So that's what we do in Watson Health, and Watson Health came to life roughly 2 years and a few months ago. And so how did we come into healthcare? IBM is traditionally not known to be a healthcare company. It's always been a great company in the field of computers. But now, with computers and healthcare coming together, how did Watson Health really get crystallized? So it started several years ago when we started working with Cleveland Clinic and to some degree Memorial Sloan in different areas. And then came that infamous Jeopardy show. How many of you saw the Jeopardy show where Watson actually beat the world champion? That's good. Not all of you. That's great. So I've got a little video that I'll show you how that led to the genesis of IBM Watson Health. Then we started working with Memorial Sloan and the Cleveland Clinic, many other premier cancer institute, Mayo Clinic, and in 2015, Watson Health was born, and it really showed the transition that IBM as a company has made over the years. It started off as the tabulating era for IBM for the first half of the last century, then came the programmable era, and now what we call the cognitive era. And games have always played a role at IBM in terms of the next stage of development. In 1956, on live TV, Arthur Samuel actually played checkers with the IBM 701 on live TV, and actually the IBM computer was able to beat a lot of other competitors. Somebody talked about the Deep Blue in 1997, beating the world champion Garry Kasparov, and then Jeopardy. So why, in the last 4 or 5 years, is this push towards healthcare? First of all, computers are getting better. Image recognition rate, the errors are going down. Computers can see, actually in some cases better than human beings, analyzing images, analyzing faces. Speech recognition is getting better. Computers can hear better. Computers can read text now like human beings. So the natural language processing capability of IBM and other companies have remarkably gone up. And there's an explosion of what we call dark data. A lot of the healthcare data is in unstructured form. So we can see better, we can read better, and we can hear better. A lot of the data is in unstructured form, big challenges in healthcare. It makes sense to tackle this explosion of data with something that could augment human intelligence. So let's take a look at the, can we get the sound?
For the lead with Brad.
Okay, so you're going to see
The Double
just a
Jeopardy
snippet
round
of the Jeopardy.
first game, I thought was phenomenal.
Watson went on a tear.
Watson,
Who is Franz Liszt?
you are right.
What is violin?
Good.
Who is the church lady?
Yes. Watson,
What is narcolepsy?
you are right. And with that, you move to $36,681.
The risk was Ken gets a daily double, bets big, gets it right. He's going to be well ahead. And then with that kind of lead going into Final Jeopardy, if he bets enough, he could end up winning the match.
Ken,
What's a committee?
We got to find that last daily double. We got to find that last daily double.
It was a crucial moment in the game. There was still a daily double on the board, and it was starting to become pretty clear that it was in the legal ease
Sorry about
category.
the missynchronization
Let's go to legal
here, but
ease
you
for
get the gist.
1200.
Watson,
What is executor?
right.
Same category, 1600.
Answer, daily double.
That was the moment when I knew it's over.
The category is 19th century novelists.
What Watson wants to do then is preserve the lead, not take a big risk, especially with Final Jeopardy, because just like for humans, Final Jeopardy is hard for Watson.
Now we come to Watson, who is Bram Stoker, and the wager. Hello, 17,973, and a two-day total of 77,147.
So, that was the first time, when a computer actually beat the best of the best human beings in Jeopardy. And recently, there were other instances where in the Chinese game of Go, there was a computer that beat the human. But what's basically happening here is computers are getting very, very good. Now, I have the privilege of actually seeing some of the results. This happened in 2011. I have the privilege of seeing some of the results from 2006, 7, 8, 9, 10, leading up to the Jeopardy show. There were 4 years of investment of $6 or $7 billion that IBM put in, really to win Jeopardy. And when you see some of the results back in 07 or 08 or 09, they look terrible. The accuracy was like 20%, and the speed was probably less than 25% of what it needed to be. And you see the improvement occurring over 4 or 5 years with the deep learning, machine learning, and all kinds of different AI technologies which were deployed to really teach Watson what it needed to know to have a shot at beating Ken Jennings. And when we reached 91, 92, 93%, we said, let's go. And somebody made a decision. We're not 100%. I mean, nobody can be 100% in a show like Jeopardy. But that's the point we said, okay, now we've put in all the research, we have done all the simulations, and now it's time to go. And that's when we decided to go into the Jeopardy show. So what happened when the Jeopardy show was played? I mean, we were really thrilled that IBM, that Watson was able to beat the best in the world. But the oncologists and the physicians who were seeing that show saw something else. They saw this when Watson was answering the questions. They saw 3 different answers with different probabilities. They looked at this and said, isn't that the way we actually determine what treatment to give a patient based on all the data that we have? The clinical data, the genomic data, the imaging data, the pathology data, all the literature that's there in the world, all the clinical trials that are out there, all the drugs that are out there. And this is 2011, mind you. The data explosion was nowhere near what it is now. And they said, maybe we can actually work with IBM and start developing a way to recommend treatment for patients. And that's when the collaboration really started with Memorial Sloan. And that led to our first product in oncology, which I'll come to in a second. So at the end of the day, whether back then in Feynman's days, looking at the punch cards and trying to digitize certain types of information are now looking at a DNA and trying to understand the mutations in the DNA. It is really all about information. And at Watson Health, we have tried to build a cognitive system that actually understands, it can reason, it learns, and it interacts. And I'll show you some examples, instead of going into the definition of all of this, what it actually does. Now, does that mean that AI is going to be as good as humans, or it's going to displace humans in certain roles? The answer we have from IBM is absolutely not. It's going to augment human beings. It's going to help them do their work more productively. You saw the situation in the UK in radiology. It's not too different in US or Canada. And if you go to countries like China, it's much worse, actually. So we believe that we have come to a point in the history of mankind where we will need AI to augment human intellect, human capability, just like the steam engine augmented our capability many years ago in the machine age. So I'm not going to go to a lot of definitions and buzzwords here around AI and deep learning and machine learning. You can look it up. There's all kinds of definitions out there. But at IBM, we are really focused on the different aspects of machine learning and deep learning, which is part of AI. And then there's an intersection with big data. So deep learning really is about using unsupervised learning. You have a lot of data, and then you let the computer figure out, how you develop those algorithms from that data that you have, and as new data comes in, you add to that, and you become better and better and better, just like we did for the Jeopardy show several years ago. And what deep learning does is it really makes use of multiple processing layers and hierarchical representations to drive the learning process. So let's show an example of this. Work from IBM China. Lots of lung cancer in IBM China, in China at this point, as most of you know, not just because of smoking, because the highest rate of lung cancer growing in China is among women who have never smoked. Women in rural areas who spend a lot of time near the coal ovens inside their homes, and they don't have proper ventilation. So what's deep learning doing? After smoking for 30 years, once you go and have a CT scan, you're going to see something in the lung. But you don't know whether it's malignant or benign. You have to intervene or do what? What deep learning does is it looks at these different nodules, and it looks at the sphericity and the speculation and the size and the shape, and it does it in layers, and it tries to determine if the nodule that you find in the lung has malignancy or not from the data that you have. And the more data that you put in, not just big data, we call it long data, longitudinal data. The more data you have of nodules of certain sizes, and you know what happened to that 6 months down the line, a year down the line, and you put it in the system, and you learn from that, you develop this virtuous cycle of data that will actually help you do a better job in terms of diagnosis. Now, it's a project in R&D at this point. We believe that's going to become reality. At IBM, we're combining this data, which we have from many different sources, including 6 or 7 companies that we have actually acquired over the last 3 years, with these algorithms. And then we have a healthcare-focused, HIPAA-regulated cloud that stores all this data, has all the algorithms, has the clinical images, and we are constantly building on our expertise. Quote from Eric Brynjolfsson at MIT. Now comes the second machine age. Computers and other digital advances are doing for mental power the ability to use our brains to understand and shape our environments, what the steam engine and its descendants did for muscle power. That's basically what we're doing. And I'm not going to talk too much about this collaboration, but over the next 10 years, we have a $240 million collaboration in research with MIT in AI and computing and quantum computing, where we're going to try to understand better the physics of quantum computing. We're going to try to understand how we actually apply it to different systems. But over the last 2 years, this is what we've been doing. We have been focusing on these areas: oncology and genomics, imaging, life sciences, value-based care, government, and consumer health, to really leverage our capability here. So as I said, we have the Analytics and Insights platform. where we have on the cloud, image and analytics and cognitive knowledge platform also resides over there. We have this HIPAA-compatible cloud, end-to-end security. We built our cloud just for healthcare, not to run self-driving cars or to play games. It is a serious healthcare-focused cloud that we built. And it's regularly updated with new data. In the last 2 years, we went ahead and acquired some of these companies like Truven Health Analytics, Explorus, Vitel, Merge, et cetera. And Truven had 200 million lives that we added to our database, 100 million plus patient records, billions of images, abstracts of many journals, 3 billion plus reference points, 4 million drug. So we added all of this to the cloud so that we could constantly develop the algorithms from the data we have. And we built on a large number of partnerships. So here are some of our commercialized products, our products soon to be commercialized. These are in the market. They are being used. Watson for Oncology has been used by over 20,000 patients just this year. So this is no longer a project in R&D. It's actually happening. And we'll talk about what Watson for Oncology does. So we have products in oncology and genomics, in the government space, in life sciences, in value-based care and imaging. And these use deep learning, sequence learning, natural language processing, domain-specific annotation and curation in the field of images, for example, in imaging. And we are constantly trying to address the biggest challenges we have in healthcare with these different offerings. So very quickly, some examples of what we are doing. In the field of oncology, Watson has demonstrated around 90% concordance with the tumor board recommendation. So what does that mean? So the tumor board comes together with all the data they have for a cancer patient. And based on all this data, radiological, genomic, what's in the EMR system, a decision is made what to do next for the patient. Watson's recommendation agree with the tumor board 91% of the time in the case of lung cancer. In the 9% it doesn't agree, Watson comes up with new insights. It looks at new driver mutations. It looks at other clinical trials that the tumor board was not able to really come up with and connects the dot for them so that the patient gets the best treatment at the point of care. Can we go back here? Sorry, oh yeah. So in ALS, Watson for Drug Discovery came up with 5 completely new genomic mutations which are helpful in developing the next generation drug for ALS. That's Dr. Bowser at in Arizona, who we worked with very closely. We'll talk a little bit about the Medtronic app that can predict hypoglycemia 4 hours ahead of time with 90% accuracy for patients with diabetes, working very closely with Medtronic. We have published a paper recently identifying the symptoms and severity of schizophrenia through MRI analysis, and Watson was able to get into subtleties of MRI analysis. Detecting the onset of heart failure through electronic health records. Just analyzing the electronic health records could reveal if this patient is prone to a very high risk for heart failures. So let's talk about genomics a little bit. Huge challenge in genomics across the world. Not only just in the Western world, but across China and India. Cancer is becoming, oncology and genomics are becoming extremely critical as cancer is becoming an epidemic. And you can see the statistics yourselves. I mean, there's a lot of demand for oncologists. Costs are skyrocketing. There is more data being produced by next generation sequencing in genomics. Sequencing costs are coming down. We're learning more and more about driver mutations, but then we don't know what to do with that. So the interpretation of the genomic sequencing is becoming more and more critical. And we are partnering with a variety of different entities, the Broad Institute down the road, Mayo, Illumina with genomic sequencing, and we talked about Memorial Sloan and others. So we have a number of offerings now in the area of oncology and genomics. And we are making sure that for a patient that comes in, we are using the EMR data, we are using the corpus of evidence that exists around the patient. We are connecting that to the literature, we're connecting that to the information we have on all the new drugs that are coming out, and we are leveraging Watson's algorithm to come up for the best treatment recommendation for the patient. We are now into 7 different cancers: breast, lung, colon, rectal, and gastric, cervical, and ovarian. And what Watson does, it comes up, just like Jeopardy, ranked treatment plans and ranked treatment options with each treatment. What has the highest probability of working? And I welcome you to visit our facility where we have actually demos of what Watson does. And feel free to get in touch with me if you have any professional interest in actually seeing a real demo of what Watson for Oncology does. Similarly, for Watson for clinical trial matching, huge challenges with respect to matching the right patient with the right trial. And as we talked about, 5% of cancer patients participate in clinical trials, even in stage 4 or very advanced stage of cancer. And how do you get more efficiency in the system? And how do you lead to better outcomes? We talked about the cost of genomic interpretation. It's skyrocketing. And we just have to do something about the plethora of genomic information that comes out from sequencing a tumor and using that effectively to link to clinical trials, treatments, the literature every day. There's 7,000 healthcare-related papers are coming out every day, and a lot of them in cancer. And making sure that you look through the molecular profile analysis, do the pathway analysis, the drug analysis, and all of that in a matter of minutes, which would take a human being over 2 weeks to do. And that's where we were able to demonstrate at the University of North Carolina Lineberger Comprehensive Center that there's a paper actually that just came out in The Oncologist that shows that in 30% of the cases, Watson was able to look at the genomic sequence of different cancer patients and link it to actual actions that could be taken based on clinical trials that existed, based on certain drugs that were there, which would have been missed if we depended solely on the tumor board. Here's some example. We are running a little bit out of time, so I'm going to accelerate a little bit. And this is what I was talking about. In the case of the tumor board, some of these mutations were deemed not actionable. With Watson, we figured out how to link this to different clinical trials or therapy, and as you can see here. This is where we're making a real difference. And these are papers, peer-reviewed publications, which have started coming out now, which would help significantly in mitigating that hype cycle. Now it's about review by peers and making sure that people agree that, yes, this is an actionable mutation which leads to a certain clinical trial or a certain therapy that's going to make a difference in the patient's life. That's basically what we are focused on, data and evidence. And that is ultimately going to make the difference. Another example, working with the New York Genome Center, sequencing that would have taken 160 hours with human curation, now done in 10 minutes. And I think this is where artificial intelligence will play a big role, and that's where Watson is playing a big role. There is a beautiful video here, but what I want to do is go to the last 2 minutes of it, if the video gods over here can hear me. The last 2 minutes, and show you.
I like working in my yard.
Yeah, why don't you?
Like
we're running out of time. So this is a patient who had end-stage lung cancer, and this video basically shows how Watson was able to help. Can you? Yeah, go. Yeah, it's too much. That's too much. Yeah. Let's stop there. Yeah.
And that he saw that there were other people.
Oops. Listen, let's keep going.
I like working in my yard.
Okay. He likes working in his yard, and he's an alligator hunter. Hey, listen, let's keep going. So the story of this patient really is that he was very frustrated. He was a smoker for 50 years, a truck driver in Florida, an alligator hunter, and came to there with a cough, and they detected cancer, late stage. And with Watson, they were able to recommend a treatment that otherwise the tumor board, may not have come up with as quickly. They ultimately agreed it was the right treatment, for the patient, and the patient was treated with a drug. And at the end of the video, he's very happy talking about his experience. So we talked about imaging, and I'm going to spend an enormous amount of time there, but imagine if AI took over some of the work of the radiologists instead of to look at these almost microscopic lesions and trying to figure out what's malignant and what's benign. If there were some recommendations made through AI, made through Watson, which would actually help them to compare that little lesion with a million other lesions which have already been characterized, and we know some of the outcomes of these patients, and then going back and saying there's a high probability of cancer in this versus the other one. Reducing false positives, lots of interventions. We talked about lung cancer, nodules. You don't know what to do with the nodules. In 96% of the cases, when you find the nodule in a smoker who has smoked for 30 or 40 years, it is benign. And today, we are going and making a lot of interventions, right? And then figuring out that the lungs collapse. Because if you smoke for 50 years or 40 years or 30 years, you're going to have a lot of comorbidities. So the moment you go in and poke a lung, the lung collapses. Then you got to bring up that lung. And then you find out there is nothing there in that nodule that's malignant. So what a waste. If you could do that more with image analysis and with liquid biopsy, looking at the cancer fragments floating in the blood and triangulating those two pieces of information, that would be fantastic. I think most of you have heard of blockchain. At this point, IBM is working very closely with the FDA. There was a case that I'm not going to talk about in the next slide to really make sure that the patient is in control of her data. I think that is really, really very important as we move forward, in control as they move from different provider systems, move from one payer to the other. And that, we believe, would save time for the patient, remove cost, reduce risk, and increase trust when you're truly in control. And we could give a talk on blockchain and what IBM is doing with the FDA for another day. We talked about the Medtronic app, where we're actually being able to work with Medtronic and for diabetic patients predict hypoglycemia with 90% accuracy 3 to 4 hours before the onset. So I know we are over time, or we got 44 seconds, which is great. So think about the clock when Earth was formed, and that starts at 0, and then we go all the way to 24 hours, right? And if you look at the 24-hour clock, humans have been around for 1 minute and 17 seconds. So this is kind of where humans showed up. You got the mammals and the dinosaurs and what land plants and whatever trilobites are, jellyfish. And computers have been around for just 1 millisecond, just a millisecond of that time. So think about what will happen in the next microsecond in this clock. And that's kind of where we are. The possibilities are immense with AI and deep learning and machine learning in healthcare and many other fields. We just have to harness the power. And in healthcare, it's all about data and evidence. And that's where IBM Watson Health is focused on. So thank you very much.